Hey everyone, it's Dr. Krystal, the Pelvic Acu here, coming to you from Portsmouth, New Hampshire. And today I want to talk to you about the type of conditions that we can support with pelvic care. So, first off, I want to say that all genders can benefit from pelvic health support. And I think that's really important for people to be aware of. And we'll go into more detail about that as we go through specifics. But let's first start off with conditions that apply to all genders. So, first off, let's talk about urinary conditions that we can support with pelvic acupuncture. The first is going to be incontinence, which, of course, incontinence is going to be leakage of urine. The second is going to be frequency of urination. So that means if our normal is urinating every 2 to 4 hours, which is generally what we're looking for in someone who's well hydrated, it means urinating more frequently than once every 2 to 4 hours. Next is going to be urinary retention or difficulty with urination. And so urinary retention means that it feels like the bladder isn't emptying all the way. And sometimes we can feel that, and sometimes we're diagnosed with that through some, special tests and that kind of thing. We can also help with dysuria, which is pain on urination. Hematuria, which is blood in the urine. Recurring bladder infections or urinary tract infections. So this is a really important one. And this is one that I think Chinese medicine is so good at helping, because what happens is in the pelvis, and we like to call this area of the pelvis kind of the lower jiao or lower energy center of the body, right? In that lower burner, what happens is energy can become trapped and it can become heavy, damp, and hot. When we have that going on, that breeds infection. One thing that Chinese medicine is amazing at, it's amazing at so many things, but one thing in particular to what we're talking about today is that it can release that heat and also really, really help to restore harmony within the body so that infections occur less frequently. Now, I have had clients who have come in who have been on antibiotics for chronic UTIs for their whole lives. In their older age, they've come in 60s, 70s, even 80s, and they've come in and had a few treatments and they've been able to experience progress and far less frequent infections simply because their body is finding harmony with itself. So that's a great reason to go and see a pelvic acupuncturist. Interstitial cystitis, which of course is another condition of the bladder and generally is pain within the bladder specifically. A lot of clients come to see me for interstitial cystitis because they have tried multiple medications that have not helped. And so acupuncture is a great way to help interstitial cystitis. Neurological conditions is another one. Now, of course, if there is the case of a stroke or spinal cord injury where the brain or the spinal cord or those nerves are affected due to some trauma or something like that, we might not be able to expect 100% of a change, but we can impact those tissues to create some level of change and some level of balance, which is really, really nice. So those are the urinary conditions. We can also help with rectal conditions, such as incontinence, which can happen with leakage through that external anal sphincter. We can help with pain during bowel movements, constipation, diarrhea, and one of my favorites is actually hemorrhoids. Hemorrhoids can be really annoying, really painful, really itchy, super uncomfortable, and seriously impacting quality of life. So hemorrhoids are something that we can really help when we treat the pelvic floor. Okay. We can also help with female-specific conditions, or as I like to say, AFAB, those assigned female at birth conditions. And that can include pelvic pain or dysfunction like endometriosis, like fibroids, vulvodynia, yeast infections, another type of infection that acupuncture can really, really help with. Painful intercourse is great. It's something that it generally speaking, when we get down to the source of what is causing pain, we're able to start to transform that pain into pleasure. And that's a really, really rewarding part of my practice. And it's something that I'm super duper passionate about. And then pudendal neuralgia. As far as pelvic prolapse goes, there are multiple types of pelvic prolapse. The most common, of course, are going to be of the bladder, of the rectum, and of the uterus. So that's when you can feel those organs sort of collapsing. And most people actually end up feeling it themselves before they're diagnosed with it, because they're like, oh, something's not right here. And it's that sense of collapse. So it's actually, when we treat prolapses, there are the components of the pelvic floor, of course, and what the pelvic floor is doing. So we want to address tightnesses, we want to address weaknesses, imbalances side to side. And also we want to support the energy within the body that is going to lift the prolapse up. And that's what we do with Chinese medicine. So as you can see, as I'm sort of working with and describing many of these things to you, is that there's like this Western component and this Eastern component. And that's really the nature of how we can provide support. Now, for those assigned male at birth, there are a number of conditions that we can help with as well. Pelvic pain is, of course, something that we can help with. Prostatitis, so that's inflammation of the prostate, pudendal neuralgia, of course, and then pelvic dysfunction, such as Peyronie disease or erectile dysfunction. So those can often be a result of, once again, the musculature and the internal system harmony and balance, as well as emotions. And so all of these combine together so that we can provide treatment. So I think that this provides an overall picture of the type of conditions that we can support. If you have one of these pathologies, or you think you might have one of these pathologies, or you're having some type of discomfort, pain that may be undiagnosed, it's a great idea to seek help. If I'm that person, I'm really honored that you're coming in. And if we can figure it out, we're going to figure it out. And if we can't, then we know the right people to refer you to so that we can provide some information for you and get you some conclusive data. But don't sell yourself short. Pelvic pain and dysfunction are not something that you have to live with. What you have to live with is your choices. So if you choose to come in to see me or anyone else to get support, you're going to be more likely to move past your pelvic pain or dysfunction than if you choose not to see anyone and just let it go with age. Because let me tell you, over time with age, these things don't get better on their own for the most part. Occasionally there's something that can, but for the most part, they don't get better on their own. They require some level of intervention. And I hope that you can see within yourself that when you go to see a pelvic care provider, that there's no shame, there's no judgment. There's just someone on the other side of the table that wants to serve you, that wants to help you, that wants to support you, and wants to see you transform from pelvic needs to pelvic care, pelvic awareness, and overall pelvic health. I'd love to be that person for you.